Okay, so Darwinian medicine and evolutionary psychopathology. Um, what this topic is about is basically tries to understand illnesses, that is physical illnesses and psychological illnesses, so psychopathology, from a point of view of evolution. Really, one of the approaches of this is to try and see whether certain things which might appear to be illnesses, or at least the symptoms of things which might appear to be illnesses, may not themselves be illnesses, but may in some ways be adaptive. So, and we're talking about a thing called an evolutionary arms race, which tries to explain why it's difficult to get rid of illnesses. Why do we become ill? Is one question. If we're so well designed by natural selection, why is illness still a big problem? I'll explain that in terms of an arms race. And then I'll start to explain some possible reasons for why we suffer many of these disorders, such as anxiety, depression, psychopathy, and a few others. I'm not going to talk about schizophrenia. That's on here, but I'm not going to talk about it because if you want to look it up in a textbook, some of the evolutionary explanations which say that schizophrenia is a form of adaptation are pretty ludicrous, really, but I'll leave that for you to read about. Okay, so the problem basically is that we, in terms of physical illnesses, we often see physical illnesses, the symptoms of physical illnesses, as being caused by the pathogen, right? So if we think about something like an infectious disease, which causes us something like a cold, which causes us to sneeze, or something which causes a fever, we will often see the fever, or the sneezing, or whatever the symptom is, as being a direct cause. In other words, the pathogen is making you sneeze, it's making you hot, it's giving you the fever. But one possibility here is that actually that it's not the pathogen which is necessarily causing the symptom. It's the possibility is expanded by evolutionary theorists and people who are interested in Darwinian medicine idea, is that the illness is actually a response, an adaptive response by your body to invasion by a pathogen. And a pathogen here is anything which infects your body, such as a virus or a bacterium. So one possibility is that the reason why you have a fever, so two of the things which happen when you have a fever, first thing is your temperature goes up. The second thing is often the amount of iron in your bloodstream drops. And it's seen these as being negative things, so the natural response of a medic, the medical profession, is to try and treat these symptoms, to try and lower your body temperature and to raise your iron levels in order to put you in a state which is more similar to the kind of normal state. But there's evidence that this is not necessarily, these symptoms are not necessarily caused by the pathogen, in the sense that it is the pathogen which is directly doing this, but it's your body's response to being invaded by a pathogen. And there's evidence that there's a thing called leukocyte endogenous mediator, or LEM. Doesn't mind what that's called, don't care that you know what that is, but it's a thing in your body which has two effects. First of all, it raises your body temperature to kill off bacteria. Bacteria tend to have a very narrow window in which they can operate, and once your temperature gets above a certain level, the bacteria, it becomes harder for the bacteria to reproduce, and to some extent the bacteria can be killed if the temperature is raised slightly. So one possibility is that the first response of your body is to raise its temperature to try and fight off the bacteria, to stop the infection, or at least slow down the infection. The second thing is that iron is used by bacteria in order to reproduce as part of their metabolic processes. So by starving the bacteria of iron, which would normally be found in kind of floating around in the blood, you would again make it more difficult for the bacteria to reproduce and thereby cause their nasty effects, because all the bacteria wants to do when it gets into your body is use your body to allow themselves to reproduce and then try to ensure that those bacteria get out of your body and into another body so they can reproduce again. So you're just simply a host, a nice place in which they can reproduce and have babies. So the conventional treatments for bacterial infection, which is to give things which reduce temperature, and one of these things is called an antipyretic. Pyretic just kind of means heat or fire, as in pyromania, and obviously so an antipyretic means something which reduces temperature. Or giving iron tablets could actually make it less likely that you're going to fight off the infection, because the medication is actually fighting with your body in order to fighting against your body, which is trying to get rid of the bacteria. So you might actually be doing the bacteria a favour by treating the symptoms of these illnesses. This is Ness and Williams, Randolph Ness, who was mentioned in the emotions lecture, and George C. Williams, two famous evolutionists who proposed this idea. So it may be that certain effects, maybe the symptoms of certain diseases, may not be directly caused by the diseases, but they may be the response of your body in order to try and fight them off. A whole bunch of other ones here. Fever may be an adaptation that helps us to repel invaders, we just saw. Diarrhea has two kind of sides of it. Diarrhea is caused by cholera, for example, as many other things. But cholera may be using diarrhea in order to get itself out of your body more quickly so that it can kind of spread itself around. But also the other aspect of diarrhea, maybe it's a response of your body to try and expel the parasite. So that might help both you and the parasites. Malaria is caused by a parasite called a plasmodium, which is pictured on the bottom here, which is a single-celled organism with all the various bits and pieces that single-celled organisms have in it. Very simple organism. Basically, it has two hosts. It has a mosquito host. It gets into the mosquito host and needs then to reproduce properly to get into a human, where it reproduces in a different way. This is a very simple organism. It's a single-celled organism, but it seems to have certain effects on both mosquitoes and humans. Obviously, it's in a mosquito, it needs to get into a human, so how does it do that? Well, the plasmodium seems to make humans smell nice to mosquitoes. So if a human being has got is infected by a plasmodium, the mosquito is going to want to bite that human in preference to somebody who's uninfected. So there you can see that the plasmodium is kind of increasing its chances of getting passed on, getting into a mosquito, because it's increasing the likelihood that the mosquito will bite somebody who's infected by the plasmodium. The second thing it seems to have, it has an effect on the mosquito when it's in a mosquito, in that it makes mosquitoes more likely to bite. So it makes them kind of more aggressive and more likely to bite. Again, increasing the likelihood that the plasmodium will be spread. So it's kind of an interesting idea. Here's an example of a very, very simple organism which is able to have effects on the physiology of humans, making them smell nice to mosquitoes, and also the physiology of mosquitoes, making them more likely to bite us. Psychology of mosquitoes, you could say. So plasmodiums are very interesting, and this is very important, that these tiny little things can really have significant effects on our behaviour and on our psychology. Sneezes can help us by expelling the parasite, but also they can help the parasite by helping us spread it, because if you sneeze out, then that's more likely to infect other people, but it also helps to expel the parasite. So there you can see that the parasite is kind of capitalising on one of our natural responses, which is to sneeze to expel anything which is causing blockage, but actually using that as a mechanism to spread itself around. So there's kind of a win-win for both us and the parasite by sneezing. Morning sickness, which affects women, particularly in the early forms of pregnancy, has been suggested again as an adaptation. This is morning sicknesses means that women can be sick, particularly as a result of consuming things that they're not familiar with, and also in pregnancy there's also a thing called neophobia, which is that women will often not want to eat anything which is unfamiliar to them. And again, it's been suggested that this is an adaptation in order to help the fetus by preventing the female from consuming anything novel which might be potentially poisonous or damaging. So the fetus is causing the female to become very fussy about what she eats, in order to make sure her diet isn't potentially going to consume anything new which might potentially be harmful for the fetus. So fetuses in some ways are taking control of females' preferences in terms of what they eat. So in all of these cases we can see there's an arms race between the immune system and the pathogens. We develop ways of protecting ourselves against pathogens, for example sneezing. That's maybe a thing which we evolved and other animals evolved in order to expel parasites, but parasites themselves capitalise on this evolved ability of us in order to help themselves to use that mechanism that we evolved to protect ourselves against pathogens, in order for the pathogens to spread themselves around. So the pathogens capitalise on our evolved behaviours in order to help themselves. So the idea of an arms race is simply that comes from the Cold War. In the Cold War, we had people who, the Americans and the Russians, largely the West and the kind of Soviet Union. The Americans will build one weapon, and the Soviets will build a bigger weapon in order to combat that weapon, and so basically everybody's building bigger and bigger weapons. And I think I sometimes give the analogy here is that if everybody would just stop, then we could spend less time building weapons, but we're always building adaptations and weapons in response to counter adaptations or weapons built by members of the opposite side. So we're all locked in this struggle, trying to build bigger and bigger weapons or have adaptations which better repel invaders. If we can repel the invaders, then the pathogens start to develop new ways of infecting us, and so on and so forth. So, and the other metaphor of this is a bit like when you go into a room and everybody's talking very loudly. You're in a bar and everybody's shouting, and the reason everybody's shouting is because everybody else is shouting, so everybody's louder and louder and louder and louder. And if only everybody would stop talking for 10 seconds, then everybody could start at a normal kind of baseline and waste fewer resources in terms of shouting and trying to be heard. So in the next screencast, I will talk about some of the psychiatric problems that are common, particularly referring to some of those in DSM-4.